37. 上巨虚. It is lower Hershey point of the large intestine. 巨虚 means great hollow. This point got its name from its location, superior to stomach 39, 下巨虚, in the large depression between the tibia and fibula, upper great hollow. Location, on the anterior aspect of the leg, on the line connecting stomach 35 with stomach 41, 6 寸 inferior to the stomach 35. Location method. The point is located 2-4 fingers measurement below stomach 35 and 1 finger breadth lateral to the anterior crest of the tibia. From popliteal crease to lateral malleolus is 16 寸. Half is 8 寸. 2 寸above, you can find this point. Indications. First, abdominal pain, diarrhea, dysentery, constipation, intestinal abscesses. 2. Atrophy and paralysis of the legs, beriberi. Manipulation. Needle perpendicularly 1 to 2 寸. Stomach 38, 条口. 条 means a long and narrow item. 口 means an opening. This point is located in the depression between muscles like a narrow passage, where the qi flowing from stomach 37 to stomach 39 goes through, so it is called 条口. Location, on the anterior aspect of the leg, on the line connecting stomach 35 with stomach 41, 8 寸 inferior to stomach 35. Location method, the point is below stomach 36, at the midpoint on the line connecting stomach 35 and stomach 41. The point is level with stomach 40, 丰隆, on the tibialis anterior muscle. Indications. 1. Atrophy and paralysis of the legs. 2. Pain in the abdomen and stomach. 3. Pain in the shoulders and arms. Manipulation. Needle perpendicularly 1 to 3 寸. Deep insertion can reach bladder 57 成山, especially in the treatment of frozen shoulder. Local soreness and heaviness can spread to the lower leg and dorsum of the foot. Stomach 39, 下巨虚. It's a lower Hershey point of the small intestine. 巨虚 means great hollow. 上 and 下 means up and down respectively, and are relative to each other. This point is below stomach 37 上巨虚, in the depression between tibia and fibula, and thus is called 下巨虚, lower great hollow. Location, on the anterior aspect of the leg, on the line connecting stomach 35 dubi with stomach 41 解析, 9 寸 inferior to the stomach 35. Location method. The point is located 2-4 finger measurement directly below stomach 36 when the patient is sitting upright with the knee bent. Indications. 1. Lower abdominal pain, bulboramus, diarrhea. 2. Atrophy and paralysis of the legs. Manipulation. Needle perpendicularly 1 to 2 寸. Clinical study on the treatment of post-surgical gastroparesis syndrome by gastrointestinal lower Hershey point. Li reported a clinical research. They found 67 gastroparesis patients with post-surgical gastroparesis syndrome. They were randomly divided into acupuncture and medication group. Gastric drainage volume and gastrointestinal dynamic recovery time were observed 2 days before and 3 and 7 days after treatment in the 2 groups. Acupuncture points stomach 36, stomach 37, and stomach 39 were chosen. Needle with retention for 20 minutes, once a day. Results showed lower He point acupuncture could significantly decrease gastric drainage volume and restore gastrointestinal dynamic compared with the medication group. Conclusion: lower He point acupuncture has a good effect on post-surgical gastroparesis, and the effect is superior to that in the control group. Stomach 40, 丰隆. This is a lower connecting point. 丰 means abundant. 隆 means bulging. This point is between the lateral border of the extensor digitorum longus and the peroneus brevis muscle, where the muscles are abundant and bulging. Thus, it is named 丰隆. Location: on the anterior lateral aspect of the leg, lateral border of the tibialis anterior muscle, 8 寸 superior to the prominence of the lateral malleolus. Location method: 1 finger breadth lateral to stomach 38 条口, on the line connecting stomach 35, 肚鼻, and the prominence of the lateral malleolus. Indications: 1. Lower abdominal pain, abdominal distension, constipation. As a lower connecting point, it is related with the spleen and has the function of invigorate the spleen and resolve the phlegm. It can be applied in both visible and invisible phlegm-generated syndromes. 2. Cough with phlegm is visible phlegm. 3. Headache, vertigo, psychosis, epilepsy. These are the invisible phlegm-generated syndromes. 4. Atrophy and paralysis of the legs, local problems. Manipulation: needle perpendicularly 1 to 1.5 寸 to treat atrophy and paralysis of the legs and swelling of the foot. Stomach 41, 解析. This is a Jing River point. 解 means untie, 溪 means stream. It is on the ankle where the shoelace is tied. It is located in a small cleft in the center of the ankle. The point name reminds us that the point separates the shin bone from the foot. Needling this point can release and tie the area, just as the shoelaces are untied at this point, hence the name 解析. Location: on the anterior aspect of the ankle, in the depression at the center of the front surface of the ankle joint, between the tendons of the extensor hallucis longus and extensor digitorum longus. Location method: with the patient's toes lifted to define the 2 tendons on the dorsum of the foot. The point is between the tendons at the midpoint of the line connecting the prominences of the lateral and medial malleolus. Indications: 1. Atrophy and paralysis of the legs, pain in the ankle and wrist. 2. Abdominal distension, constipation. 3. Headache, vertigo, psychosis, epilepsy. Manipulation: needle perpendicularly 0.3 to 0.5 寸, or needle transversely 1 to 1.5 寸toward gallbladder 40 or spleen 5. Local soreness and distension can spread to the entire ankle. A 17-year-old male suffering from headache for 3 years. He often has pain in his forehead and 2 temporal regions. The headache gets worse at noon in summer or when feel hot. Dizziness and blurred vision, with a bitter taste and bad breath, dry throat and thirsty, dry and stuffy nose, yellow urine, deep and rapid pulse. What is the diagnosis? According to his pulse and syndromes, Yangming headache. Treatment should be clear Yangming heat, relieve pain. Reducing method at stomach 41 and extra point Taiyang. After first treatment, the headache relieved, but still he suffered from dizziness. The patient cured after 3 treatments. Stomach 42 Chongyang. This is a yuan source point. Chong means surging, refers to the throbbing felt when palpating an artery. Yang refers to the dorsum of the foot. The point is on the elevated area of the dorsum of the foot, where the pulsating artery may be palpated, hence the name Chongyang. Ancient people used it to judge whether stomach qi was strong or not after feel this artery. Location: on the dorsum of the foot, at the joint of the base of the second metatarsal bone and the intermediate cuneiform bone over the dorsalis pedis artery. Indications: 1. Stomach pain, abdominal distension. 2. Deviation of the mouth, swelling of the face, toothache. 3. Swelling and pain in the dorsum of the foot, weakness and numbness of the foot. Manipulation: needle perpendicularly 0.2 to 0.3 cun. Be cautious, avoid puncturing the artery. Scarring moxibustion is not suitable here. Stomach 44 内庭. This is a yin spring point. 内 means inner, 庭 means courtyard. This point is on the margin of the web between the second and third toes on the dorsum of the foot. The toe crease is like a gate and resembles the entrance to an inner courtyard. Thus, this point is named 内庭. Location: on the dorsum of the foot, between the second and third toes, posterior to the web margin, at the border between the red and white flesh. Indications: 1. Toothache, swollen and sore throat, nosebleed, deviated mouth. 2. Febrile diseases. 3. Stomach pain with sore regurgitation, diarrhea, dysentery, constipation. 4. Swelling and pain in the dorsum of the foot. Manipulation: needle perpendicularly or obliquely, 0.3 to half cun. The last point, stomach 45, 立对. This is a Jingwell point. The 5th stem of the 10 heavenly stems is known as Li, and the foot Yangming belongs to stomach and is called the 5th earth. Thus, Li refers to earth. Dui means mouth. According to the Book of Yi, the character Dui is equivalent to kou, mouth. Stomach 45 in treating serious disorders of the mouth. The foot Yangming meridian goes along the mouth and circles the lips, so the point is called 立对. Location: on the second toe, lateral side of the distal phalanx, 0.1 cun, proximal lateral to the lateral corner of the second toenail at the intersection of the vertical line of the lateral border and the horizontal line of the base of the second toenail. Indications: 1. Toothache, nosebleed, swollen and sore throat. 2. Febrile diseases. 3. Profuse dreaming, nightmares, psychosis. Manipulation. First, needle superficially 0.1 to 0.2 cun. There will be local distending pain. Or use a 3-edged needle to bleed the point. Precautions. Needling this point is prohibited in pregnant patients, and scarring moxibustion is not suitable. Summary. Remember the location of important points and accurately locate the commonly used meridian points on the other people. Specific function. Stomach 25 for large intestinal or gynecology conditions. Stomach 36 for chronic deficiency syndrome. Stomach 37 for large intestine conditions. Stomach 40 to resolve phlegm. Stomach 44 to clear stomach fire. Manipulation. On face, we should slow insertion for points on the face. Since it's full of blood vessels, avoid lifting and thrusting for points around the eyes. Abdomen. Control lifting and thrusting for points on the abdomen to protect internal organs from being damaged. Avoid points on the lower abdomen for women during pregnancy. That's all for today. Thank you for your attention.